Hello, welcome to our next live Early Career Blueprint series. My name is Dr. Hampole. I come from Advocate Christ Medical Center and Advocate Hope Children's Hospital in Oak Lawn, Illinois, where I practice musculoskeletal electrodiagnostic and acute inpatient rehab medicine, and I'm the lead physician for the Skating Council of Illinois. The Early Career Blueprint series was started almost 2 years ago by the Women in Leadership Lead. The goal of this series is to help fill the large gap in knowledge in career navigation, and development, especially pertaining to women physicians in sports medicine who are a minority in the field. However, all genders are welcome to attend our series since we speak about hot topics that could be useful for everyone too. For those of you who cannot join us live, you can catch this and the other recordings on the AMSSM YouTube channel. Today, we'll be talking about how to burn out of burnout in sports medicine. While this talk is tailored towards physicians, it in actuality can help all in the health professions and since we all work together as a team. We had an excellent keynote discussion and ICL on this topic at the last conference. This session will zoom into personal narratives and life experiences in burnout prevention, as well as tangible remedies. After my brief presentation, we will have approximately 45 minutes of a discussion with some very accomplished panelists who I will introduce shortly. Everyone is welcome to participate, so please put your comments and questions in the chat box. We are very excited to have you all join us today. So as we know, burnout has a definition. It has an ICD-11 code. It's important to realize that burnout is specifically related to occupational phenomena. It is not it's not considered a medical condition. However, it is closely intertwined with mental health conditions. But it's important to also rule those out when trying to figure out if this is burnout or a mental health disorder or both. And very important to recognize, know the signs and symptoms of burnout. Of course, this was again all brought up at the recent conference, so I'm not going to go into too much detail here. But the common signs of burnout are listed here: cynicism, lack of group morale, lack of motivation, lack of a presence, not caring as much as before. Oops, sorry, my slides just went off. Not being cordial or collaborative as much as before, feeling agitated or unhappy about going to work. And when it gets out of hand, it can lead to some red flag symptoms where someone really needs help. And those are listed here. A lot of similar symptoms as some psychiatric conditions, but also simple things like difficulty concentrating, insomnia, extreme fatigue, nightmares, heavy use of substances, weight changes are also some signs of some red flags of burnout. And the person going through burnout may not even recognize they're going through burnout unless it's their second time. So very important to understand these. And one thing I want everyone to think about for a second, and we'll talk more during the panel discussion, but do you know anyone who, do you have a moment when a person that you've met before that fit any of these, that had any of these signs or symptoms? Do you remember someone who was seeing patients like objects, a cynical physician that you worked with, attending that didn't seem motivated? So something to think about as we go through our this discussion. And then sometimes these symptoms might not be seen just at work, they might be seen at home as well. So important to keep that in mind. So now, let's see here. Okay. Of course, we know the stats are crazy, they're dramatic and scary. So these were talked about before, not gonna rehash it all, but AMA has a stat of 62.8% of physicians in 2021. Medscape had an even higher statistic of 80%. So very alarming and scary. The speakers on this panel have done an amazing job designing and publishing the results from the survey given to all members of the AMSSM. 15% completed the survey. Here's some of the demographics of the members who completed the survey. As you see, there's a heavy amount of males, many Caucasians, and a lot of family medicine doctors who filled out the survey. However, this could be representative of the membership of AMSSM in large, probably. 50%, 50.2% reported burnout symptoms. So this is more information can be when in there when you access their talk. There's more information about, and there's also a published article on it as well. And this is just a visual of where sports medicine physicians lie in terms of association comparison to other specialties. So the top 3 causes and the top 3 recommendations from that came from the survey are listed here, and as well as the top 3 helpful solutions implemented. Not going to kind of go into too much detail, but I do find the respect issue was one of the issues. Top 3 recommendations. A lot of the sports medicine doctors wish there was more respect. And more respect may help with burnout. I do think that this could be part of a larger issue, given that the demographic of sports medicine professionals is not very diverse, as kind of a snapshot of this is in this slide here with gender and race as well. So something to think about. So here's just a slide defining what too much work might mean. Doctors do work a lot. Not necessarily with direct patient care, as we know already. So why should we care? Well, burned out doctors are more likely to leave practice, which reduces patient access to and continuity of care. Burnout can also threaten patient safety and care quality, especially when depersonalization leads to poor interactions with patients, and when burnout physicians suffer from impaired attention, memory, and executive function. And that's from the Agency for Healthcare and Research and Quality. Of course, sports doctors not just spend not just a lot of time in clinic, but they spent a significant amount of time with athletes in training room and at the events. And they have, could be heavily influential to the athletes. So it's very important in our field that we addressed burnout as well. It's also why it should be addressed. The alternative is so much better, to have engaged doctors who are interested, absorbed, and have better relationships with their patients and their colleagues. So that's why we should care. So it all starts with of course, the government. So very important to be active as much as possible, with laws and government. But for example, the anti-abortion laws and any kind of transgender laws that are considered discriminatory have led to certain physicians moving out of certain geographic areas. For example, transgender physicians did not feel safe or comfortable practicing in certain states, and so they all left, like in a mass exodus, to other states. Same for pregnant women physicians, not comfortable with the care they would receive in certain states, may have left to go practice in other states. And so, these kinds of laws have affect burnout, because then it leaves other physicians to be practicing. They're basically a lot of areas would be depleted of physicians and lead to burnout as well. The other thing to think about from the government standpoint is there also positive things is there was an act, the Dr. Lorna Breen Healthcare Provider Act, Protection Act, was signed to help protect physicians from burnout, and all of us can continue to support and reauthorize this act. It's very easy to do online, so it's very important that we keep involved and support this act every year. And then there's been some new laws passed in 2021 and 2022, protecting, limiting the access medical lawsuits, which also contribute to burnout in the physician population. And so good to keep up on those as well, to prevent physicians leaving certain states and causing more burnout to other physicians. So again, this was all talked about at the previous talk, but I just want to here's a list of organization level solutions that would help with preventing burnout. And the reason why prevention of burnout is so important is because burnout, once you are burned out, it's a very long process. It's painful. It's exhausting. You may not be able to get out of the situation again. You may not escape burnout, or you may, but it would take so long, and it's just so much financial, emotional strain for everyone involved, including the physician, the patients, and the hospital system, and the country. So the first step is just knowing what burnout is, spreading awareness, understanding, its causes and solutions so that we can hopefully help prevent burnout. There's organizational level solutions. I've listed them here, not gonna go through all of them in detail here, but that's but I do want to highlight there's a concept called administrative harm. There's some recent articles on it. Good topic to know about. But a lot of it centers around communication between administration and physicians, and increased communication and transparency, organizational transparency. There's also other things with AI, helping physicians do less administrative tasks and charting, and offering flexible and part-time schedules, choosing leaders who model support and work-life balance, and floating clinicians who can cover unexpected leaves. So some things that organizations can help with. And here's some more things organizations can do to help prevent burnout. I don't know if any of you have heard of the Good Hearts Law. I didn't know about this, but then when I was talking to our CMO recently, he brought my attention to it. Basically, the urban legend is that in Russia, they were trying to make nails, and they wanted to increase the number of nails made. So they measured people on how many nails they made. So what ended up happening was there were thousands of tiny, useless nails being made. So then they shifted it and tried to focus on the weight of the nails being made. What ended up happening there was then a few giant heavy nails were made and also useless. And so important concept in terms of improving measuring outcomes and improving things, which we can discuss later in the panel discussion if anyone has any ideas on that. So let's see. So then here's some individual level solutions. Obviously, burnout's a systemic issue, but what can we do? Because we cannot control the system entirely. It doesn't fix overnight. So we have to protect ourselves, right? Or do as much as we can to prevent it. So here's some ideas that, a lot of the articles on burnout mention, especially focusing on the positive, speaking up early, but not expecting anything, is very important. Balancing your life. There's a picture here from Dr. Helen Folker, who was also on the AMSSM talk on physician well-being. Very well outlined the importance of balance, especially from the New Zealand perspective, especially with, when you look at the mental, emotional, spiritual, physical well-being, connection to land and family and social support systems, and how that all can holistically help the person and subsequently help with burnout. But yeah, knowing when to say no, being able to let go, being aware if you're comparing yourself to others, all of this can help with preventing burnout in an individual. But asking questions like what matters to you, sleep, nutrition, exercise, family, friend time, and medical care, making trade-offs and effective time management, and then compartmentalizing your presence, being present outside of work, but also then being present at work. So that's important as well. And then here's some more individual level solutions, and there's thousands of them. We would run out of time if I went through all of them. But setting boundaries at work, having discussions with a diverse group of physicians can also help offer a lot of perspectives as well. And then once you are burned out, what do you do? So this is, you can go through, all of the ideas listed on the prevention of burnout slides, but recovering from burnout, you can also, things like reinventing yourself or talking to someone, journaling and visualizing. One thing I wanted to highlight here is Psychology Today has a great website where you can put your zip code and medical insurance information, and you can find therapists very easily, and you get their credentials and photo. There's some great apps out there to help with meditation, passion projects, and side hustles. They can also be great ways to help with burnout if you're in burnout. If all else fails, you may have to take a break. I mean, that's the end all be all. It's not the end all be all. It's an option, and then you can always go back when you're ready. And then again, there's there's a bunch of resources that our panelists have put together at the AMSSM talk. I kind of just listed them here for everybody. So I would just take a screenshot of this and save it, just since there's no easy way to disseminate it on this talk. But great resources. I added a couple to them, but here's one on general resources on well-being. Here's another on personal resilience. Here's this done. And then some more on personal resilience, some more resources were related to the healthcare system. And then family medicine focused resources on burnout, pediatrics resources on burnout, PM&R resources, emergency medicine resources, sports medicine resources. If you guys need these links, I can also enter them in the chat during the discussion and find another way to share them with you guys if you need them. But they were also, a lot of these were handed out at the conference as well. Oh, and then international resources as well, because it is an international problem. All right, so enough of me. I wanted to introduce our panelists. So Dr. Sangili Chandran is our first panelist. He is our, well, I work at the same hospital, but he's a director of primary care sports medicine program at Advocate Christ Medical Center and family medicine residency program. He was previously an orthopedic surgeon in India, getting his degree from Madras and then Madurai universities. He is a clinical associate professor of family medicine at Chicago Medical School, a clinical instructor professor of family medicine at the University of Illinois at Chicago, and the head team physician of Oak Lawn Community High School and St. Xavier University. He has taught and mentored numerous generations of trainees, including their own children. He has yet to have a trainee's grandchild be his resident, but that's his next goal. He has received numerous awards, including the Advocate Medical MVP Award for the South Region, the Excellence in Teaching Award from the Advocate Christ Family Medicine Residency Program, and over 8 years of Teacher of the Year awards. He has offered a free clinic for injured athletes at Oak Lawn Community High School since 1996. And then our next panelist is Dr. Elizabeth Albright. She is a primary care sports medicine physician at University of Michigan Health West in Grand Rapids, Michigan. She completed her undergraduate coursework at Ferris State University and attended medical school at Michigan State University College of Osteopathic Medicine. Dr. Albright completed her residency training in family medicine through Eglin Air Force Base and Western Michigan University. She then went on to complete fellowship training at primary care sports medicine at Penn State University and State College, Pennsylvania. Dr. Albright practices full scope outpatient family medicine and sports medicine, also serves as a team physician for the Grand Valley State University Athletics, Grand Rapid Griffins, American Hockey League, and Grand Rapid Rise, the Professional Volleyball Federation, and several area high schools. Dr. Albright is an advocate for holistic personal health and well-being and strongly believes that exercise is medicine. She is passionate about the alarming rate of burnout among physicians, and after being burned out herself, she completed the AAFP Leading Physician Wellbeing Program in 2022. Since completing the LPW certification, she has been working diligently within her healthcare system to decrease administrative burdens on providers. And then we have Dr. Rahul Kapur. He is the Director of Program of Sports Medicine for the Department of Family Medicine and Community Health at the University of Minnesota. He previously served as a Director of Education Programs in Sports Medicine for the department from 2019 to 2022. He is also core faculty for the St. John's Family Medicine Residency and the UMN Primary Care Sports Medicine Fellowship. He came to the Twin Cities from the University of Pennsylvania in Philadelphia, PA. That's where he went to college, where he served as a fellowship director for the Penn Primary Care Sports Medicine Fellowship from 2010 to 2018. He served as a chief medical physician for Penn Athletics from 2007 to 2018. He currently serves as a team physician for the Minnesota Twins and St. Paul's Saints, and was a team physician for the USA Lacrosse Women's Senior Team from 2017 to 2022. He also served as a co-medical director for the Twin Cities Marathon in 2022. He recently led the published aforementioned survey and the recent talk on physician well-being at the 2024 AMSSM Annual Conference. And then we have Dr. Emily Miller. She is a health sciences assistant clinical professor at UCLA, where she practices both family medicine and primary care sports medicine, and serves as a faculty member for the Primary Care Sports Medicine Fellowship. She is the team physician for the UCLA women's soccer team. Her interest in physician well-being began through her own personal experience with burnout. She completed the AAFP Leading Physician Wellbeing Program in 2023 and continues to work on her own work-life integration. And finally, we have Dr. Ankur Verma. He is the proud program director for the UIC, University of Illinois Chicago Sports Medicine Fellowship. He also serves as the associate head team physician for the UIC Flames. He went to medical school at Michigan State University, residency at Schwab, and Rehabilitation Hospital in Chicago. In 2022, he received the Golden Apple Teaching Award from Schwab. He grew up in the Detroit area and still considers himself a Michigander. So I'm going to open it up to questions if anyone has put anything in the chat box. It doesn't look like there's anything in the chat box yet. So I have a bunch of questions that kind of I compiled from others recently. But I wanted to ask you guys if anyone wanted to share. I'm trying to see if I can get you guys on here. Where's my, there we go. All our panelists. I can see you. Yeah, so I wanted to ask if anyone wanted to share a situation where they've seen someone or themselves have been burned out multiple times. Do you see it happening multiple times to the same person, or do you see that it tends to happen once in yourself or others around you?
Since nobody's answering first, you introduce me first. Being a old man, I will talk first.
Okay.
Is it okay?
Yeah, go ahead.
Yeah, because I'm involved with the residents. Actually, we have arranged for a retreat tomorrow, which we are going 65 miles away to Kankakee, Illinois, for a couple of days retreat for the residency. So I see that often, not only on resident, which is very common because of the time schedule and everything what we see. Even with my own colleagues, I see that because they were my residents before, now they become a faculty. When they work with me, the problem is the doctors are, I call them recovering perfectionists. Most of the doctors are perfectionists. That is where the problem starts. We want to do everything perfect, and we pay dearly for that, whether ourselves or the work or somewhere that happens. So somehow we have to coach and teach so the people will know that you are as important as the other person across the table. Once that equation comes to level, we have some idea how to help. Because you already talk about, your presentation was so eloquent with all the materials you already put. I will wait for others to talk, then I will jump in.
Personally, I've had burnout in multiple places. Currently, I was going to introduce myself as I'm Rahul Kapur. I am burnout. At my previous institution at Penn, my burnout was really trying to do everything. I kind of buried myself in my work early on in my career, and I felt like that is all that I needed to do all of the time. And then what was really hard was trying to pull back and try to find balance once I set an expectation that I was available 24/7 as I was growing a practice. And so I think you can have early career burnout, you can have mid-career burnout, and you can have late career burnout. And the importance is really always reassessing what you're spending your time doing and how that aligns with your priorities as they change in life. And so my early career burnout was really, I did not have anything else that I was passionate about and just buried myself in my work, and that was an unhealthy balance. My mid-career burnout, which is currently happening, is that I have two small children. I have a 16-month-old and a 4.5-year-old. And I am missing out on them growing up. And, I was at a game recently, and it had not occurred to me, but one of my colleagues pulled me aside and he just asked, "Are you okay?" And I said, "What do you mean?" And he said, it has it is evident to the other people around you that you're not yourself. And I started crying and was just like, we've been going through a lot at home with illness and stress. And I remember my daughter said to me, "Daddy, I miss you when you go to baseball." And I cried and I said that I won't do that. So I have made the decision to not cover games for the next 2 seasons. I'm going on a sabbatical. I told the team. If that ends up being a permanent sabbatical because they move on, that's wonderful. If not, they said that they would like me to continue, but I basically am transitioning to another colleague this year, and the next 2 years at least I won't cover, and then we'll reevaluate then when my son is 3 or almost 4 and my daughter's 7. And if they want to come to games, then we'll go cover baseball. And if they don't, then we won't. So I think it's really important to find a balance of saying yes and saying no. If you're early in your career and you say no to everything, you won't be asked to do anything. And that's just a reality that, I'm not the oldest one on the panel, but I'm old. And I also I have like very strong biases about the fact that when somebody says, "Are you available?" the answer is yes. And then you figure out if you're available. But if you say no, then you're not going to get asked again. And so as you're building a career, the answer is always yes. And that's what I always felt. I don't know if that's true, but I know that saying no early on in your career is not necessarily going to help you build the career that you want. Later in life, I think it's hard because you get used to saying yes to everything and everybody else gets used to you saying yes. So saying no is really hard, but I have become better at it. And that's my way of helping mitigate my mid-career burnout. As I get closer to retirement, not that I'm counting the years till the exact day that I retire, which is planned, by the way. No, I'm going to have to readdress what I want to spend my time doing at that age, my kids may not want to hang out with me. And then I may have extra time to do different things, and I may want to, do more and less than others. So anyway, that is my journey, and my advice is to always check in with yourself about what your priorities are like and what your vision is for yourself, and then don't be afraid to readdress it. Just because other people have expectations of you, the most important people in your life should always be prioritized. That's all.
Yeah, I wanted to actually just kind of piggyback off of that because a lot of what Dr. Kapur said really resonates with me. I started as program director very early on. I was only 6 to 7 months into practice. I was 31 years old. I had no program coordinator, and I was in the middle of a faculty transition where a lot of our attendings were leaving or retiring. With an administration that wasn't always helpful, and so just a nightmare scenario. And on top of it, I was the type of person who said yes to everything, to start off. Because I'm like, this is great. I'm a D1 team physician. I've got a fellowship program, building my career. This is awesome. And it was until I realized, probably similarly to Dr. Kapur, I was doing everything. And even in my interviews, this is in the thick of COVID, so we were in virtual interviews. Even interviews, I was the one assigning people to the different Zoom rooms and all that, to that point. And I think there is a certain point where self-respect comes into play, and I realized like how much like administration, for instance, was kind of getting out of me. And so I took a lot of things in my own hands. I started being the annoying person, I started being the annoying person in the meetings, the annoying person on the emails. It took a little time, but a couple of years later, I have a fellowship coordinator now that I actually had to find on my own with the help of Dr. Hutchinson, who's our head team physician at UIC, and turned out to be one of our trainers, which turned out to be a great addition. I have we made a couple new hires. I've been by myself as a primary care sports medicine person for the last 2 years. So now we made changes there. So, and then, I got married. I had some family health issues as well. So all that stuff just kind of squeezing in on me. But I think once you kind of find what you're prioritizing, whether it's your own mental health, which should come first and foremost, and then your loved ones, then everything kind of falls into place a little bit better. It probably doesn't solve everything, but it does help things a little bit more.
Yeah, so I am one of the younger people on the panel, and I'm 5.5 years out of fellowship at this point. And I started my current position, which is my first one after fellowship, in January of 2020. And 5.5 weeks later, the world shut down. So I'm building a practice. I'm in a new city. I'm isolated from my family. I'm isolated from my friends. I was single and didn't have kids at home. So my clinic was one of the clinics in our organization that stayed open. So I had sort of volunteered to see people because I wasn't as concerned about taking it back home to somebody. So I'm seeing all of the sick people they kept 4 of our sites open. So they were kind of regionalizing things. And I was seeing everyone else's sick people too. I'm listening to coworkers complain about how they're forced to stay at home and not see patients. And I'm sitting there like, I'm seeing all of your patients. So please stop talking because you're on a paid vacation. And all of that just compiles. And so here I am now, it's May. I'm 5 months into practice and ready to quit. And that was the moment that I was like, this is not sustainable. I can't do this. I need help. And had to reach out and get it. Speaking with the director of our fellowship, who's helped to tailor what I'm actually seeing. Cause I mean, I came in with these grand ideas of what my sports medicine practice was going to look like. And I don't even have a family medicine practice. I have a COVID practice. So trying to tailor some of my career goals with taking some of that step back of like, I can't be the only one that's doing this. I need help in just from a clinic standpoint, getting some technology tools at work so that I'm not stuck 2 weeks later with 40 some open notes that I can't even remember seeing the patient. And then also recognizing kind of from a more medical perspective of like I had undiagnosed ADHD, which was compounding everything. So for me, addressing each one of those things one piece at a time has made a huge difference. But it's hard to take that first step because we are all successful people. We were good in school. We passed our tests. We passed boards. We got through residency, and the hell that can be for some people. Like now you're in attending and it's supposed to be like you've made it. This is supposed to be the good time, right? So it's hard to reflect on that and be like, this is not what I thought it was going to be. And then making decisions to change if that's what you need.
I think
I
like
can also chime in, or we can move on to the next question. I don't know which.
Go ahead. I guess Emily, go ahead and chime in, and then Ankur had something to say.
I would kind of echo what everyone else has said in terms of like the tailoring your practice. Because I've been in the same job for 6 years, but my clinical practice looks very different from how it looked when I started. As I realized that being in clinic 8 half days a week, in addition to being on the fellowship faculty, in addition to working with student athletes, in addition to being expected to do research, just didn't quite work for my well-being. And so while I still haven't found, I don't think like the right mix of things at work, I continue to sort of evolve that clinical structure to find what feels sustainable to me. And so I hope that, every year as I kind of tweak one thing and take something out and put something else in, that I'll find something that feels that I can continue to do it year over year versus saying after a year, like, okay, this wasn't quite the right combination of things. The other thing that I think is really important is finding what keeps you excited about your job and happy. And some people say, like, oh, well, why don't you just give up covering college athletics? Like, then your nights would be free. You wouldn't have to do that. And my answer is literally the reason I can sustain going to clinic is because I love my collegiate athlete experience and I love taking care of them. And that is what sustains me to be able to go to clinic and see 30 patients in a day and then spend 2+ hours hypothetically replying to patient messages. But it is those things that bring joy, I have to make sure I keep and then find ways to make the other aspects more sustainable.
Yeah, so much about what Dr. Albright and Dr. Miller said just really rings true to me. And actually, Dr. Albright, we were probably at Michigan State together because I started around the same time, October 2019, and building things up, and then COVID hit. And what keeps me going at my job, I always keep in mind, it's the fellowship and my trainees, and it's the athletes, and it gives my job so much meaning. And what you can, when you find what you're passionate about and what you love about your job, then you know where your threshold is for all the other crap you have to deal with. And maybe one day it'll cross that threshold. I don't know. But I think just being grateful and having that mindfulness to know why you're getting up in the morning to go to work is super, super helpful and kind of keeps the fire going a bit.
Can I say something, Amy?
Yes, please.
Having lived, because Dr. Kapur put it in a right way, early part of life, middle part of life, and late part of our career. I'm in the tail end of the career, so I can revisit whatever you are going through now. I met with 2 accidents in my early part of career because of lack of sleep. They put me on call back to back, 24, 48 hours. So I slept on the wheel. But the best part of it is I was alive. So that's all I can think of. Now, going to the middle part of my career when I started my director as a sports medicine, because there was nothing when I came there. So I started everything. I was like you guys, covering 4 high schools. Could you believe that? Those days, I'm talking about 90s. There's no Friday night lights in my area. Everything is a Saturday game. So I have to juggle between one high school, 20 miles other high school. So I spend whole weekend out of my house. Why I did it? Exactly what you guys are going through. You want to impress somebody. You want to develop a career. You want to build up everything. That's what you pay for. But I woke up one day because my son was in the middle school. He was crying. I said, "What happened? Well, you didn't come to my basketball practice. You didn't come to my football practice." I said, "Okay, I will work on it." I went to my chairman. We had a chit chat. I said, "These are the things I want you to accommodate for me. Can we do that? Or I can always," because the orthopedic group want me to hire to their place. They know my potential. So they said, no. Whatever you do, you just put it down. We will accommodate. And the rest is history. Not only that, you always have a ball in your court. That's the way to look at it. Don't ever think that you will lose something. You can always find something else. So that is not the end of the thing. I put a lot of effort in my son. Now, when I mentioned to him, I'm going to be in the panel with the Dr. Verma, he said, "Oh, he's in my school," because he is at U of I now. He's a second year medicine resident now. He was very happy to be with you. Anyhow, so
I'm glad to hear that.
yeah, no, the priority is when you change it, it does help how you put your specs in a different way. So you can change your priorities and get it done. And one more word before I close, because this is very important. I was fighting with my administration for an ultrasound for almost 10 years. They will never budge. They said, you don't have enough patients, the same story. So what I did was, I went to my friends who are doing OB, guys, you guys should come with me to talk to the administration. They said, oh, if you don't have ultrasound, I cannot do OB anymore. The next month, the ultrasound machine was in my office. So sometimes you have to collaborate with your colleagues to use our resources. They can always work with you, because I don't know, whatever department you are on, family medicine, PM&R, whatever it is, you just find your niche. You find your colleagues as the best friends. They are the one who is going to fight for you. It is better to fight with others than one person. You did a cavalier way of fighting, but sometimes it doesn't get the way done. When we have the force like others, it does get it done. So I will close it now. If you guys have any questions, I will try to help.
That was
Yeah,
all
I agree with that completely. Sorry.
Go ahead.
I agree with that completely, because the funny thing about burnout is it's really isolating, and it's really easy to feel like you're the only one experiencing it.
Mhm.
And you're not. You may feel that way, 100% guaranteed. You're not alone. Even in your organization, in your office, you're definitely not. I mean, look at this panel. Like, there are other people that are experiencing this. And being open about it, being self-aware, but also aware of those around you and collaborating together, collectively, you can make change in your health system.
Yeah.
You by yourself going in and saying, I'm burned out, it may, I mean, hopefully it makes a difference, but it may not. But if you can start to speak to the cost of replacing a physician were you to quit, if you can start to talk, like, I had another round of burnout, it was probably about 9 months ago, and I literally went into my office manager. I was seeing 16 to 18 physicals or AWBs with no sports medicine all day, every day, 5 days a week. And that was my entire schedule. And I was like, I am practicing checkbox medicine. It's not good medicine. I'm not giving my patients my best. Their concerns aren't necessarily being heard, because I'm just trying to get everything documented, because if I don't document it at the time, they all blend together. I was like, this is not sustainable. I said, and if we don't have a way to set some goals for how this is going to change, I can't tell you how much longer I'm going to be able to keep doing this. And it literally got to a point of saying, I can't keep doing this. So if you want me to stay, we have to work on this now, because I'm not, computer. I'm not ready to quit. I don't want to quit. I love my job. But if this continues to be my job, I'm going to have to quit for my well-being. And not so much throwing down a gauntlet for people, but those words get heard, because the cost of replacing you, it all comes down to money, right? The cost of replacing you is over $1 million. There's science that says that. So it's cheaper for them to make adjustments to your schedule for you to see 3 or 4 less patients in a day than it is for you to quit and them to have to hire someone to replace you. And your organization hears dollar signs. It's the world we live in.
Yeah, those are all amazing experiences, and in a way that has helped others, yourself, escape burnout and understand burnout, and also will help the people who view this. What would you, given that physicians come from we come from a background where we're all type A go-getters, right? We are like, yeah, we got this, we can handle it, and we try to do it all, right? Like you guys mentioned. What advice would you give trainees, aside from being aware of what burnout is? What would you tell someone coming up and, going through medical school or residency or fellowship? What would you tell them? What advice would you give them, aside from, sharing your own personal experiences and educating them about burnout?
One of the things that I feel like the Leading Physician Wellbeing program taught me was how to communicate about burnout a lot better, how to be more open about it. And so part of it is just sharing the experience so that the first time it happens to them, they know, oh, hey, I remember hearing about some of my attendings in the past, like they've talked about this happens to people, and being more aware so that they can recognize it. Because if you can recognize it as it's starting, it's so much easier to deal with. So much easier. And so the biggest thing for me is like just start talking about it. Be open about it. Make sure that people realize it's okay to talk about it. And work on destigmatizing it.
I would tell them to get hobbies. Um, I think having a life outside of work, helps a lot. And actually placing an importance on those hobbies. I know we kind of, growing up, all of us have, school, it was work, that type of thing, and we kind of put our hobbies and other things aside. But, there's one thing that, COVID, the shutdown taught me was you better have hobbies. And and for me, that helps you achieve a little bit better balance, a little bit better work-life balance. And I have a bunch of hobbies that I give, equal attention to. And I think that just helps kind of, I think of it as like I have a bunch of different cups, I have a certain amount of marbles. You don't want all those marbles to be in one cup. So in case that cup, spills over. So I just kind of deposit it in a few different cups, and it kind of helps me keep my sanity intact to a degree, from a day-to-day basis.
I think
That's
also,
sorry, go ahead.
okay. I think also recognizing, and my thoughts on this have sort of evolved, is that medical school and training are also like they're going to be hard at certain points in time, and that's not a bad thing. Like, we have to recognize and prepare people for what they're going to be doing. But if you're in a supportive environment, if you're in a place where you can speak openly about the experiences that you're going through, and you have supportive faculty, can make those challenges a little bit easier. And so I think also just recognizing like there are going to be some really hard times, and like a rotation may be difficult, or night float can kind of suck sometimes. But it is a part of our medical training. So identifying those hard parts and knowing, like, finding the support to get through them, but we can't take all of the hard parts out of our medical training, because then we're not going to be ready to work as a physician. So like also recognizing that there will be challenges during training, and that's okay. And we all have challenges, just like we're going to have challenges as attendings, and we're not going to know everything, and we're going to be put in difficult situations at times. But those challenges are a normal part of our education that are going to help prepare us for the future.
Yeah, I think I echo that. I think we're not doing a great job preparing our trainees for what they're signing up for. And then the other part of that is, if you do know yourself well and you know what you're looking for a job and surrounding yourself with people who have similar priorities is really important. If you sign up, if you are not interested in seeing patients 5 days a week and covering sports in the evening and weekend and doing all of these other things, then don't sign up for that job, right? I don't think anybody is trying to dupe you into that, right? There's a number that is assigned to the productivity that you have. There is a time that's either protected or not protected to do work. There is a very clear statement of whether that what you're doing outside of regular hours is considered work or not. and having been in different environments, those priorities are clear. We just want to kind of put our head down sometimes and be like, well, I'm going to change that. And like the leadership will show you what their priorities are. And you just have to ask them that when you're looking for jobs. And if they align, then go to it. And if it doesn't, realize what you're signing up for and how that's going to be in conflict with you at some point. And whether that means you work less than 100% or whether you decide that you're going to stay there for a certain amount of time because this job pays well and you're going to pay off your loans and then you're going to move on. Like, you know, be strategic about what you're doing, but don't fool yourself into, you know, when a practice tells you that they're going to give you a lot of money because they expect you to see this many patients a day, 5 days a week. And then you get there and you're like, well, all I'm doing is seeing patients. Yeah, yes. That's actually why you're getting paid all this money. And if you want teaching to count as work, then talk about what that looks like. And if you want coverage to count as work, talk about what that looks like. And if you want your academic time to not be your own time, talk about what that looks like. And be very clear about what your priorities are with work specifically. And then also talk about how that matches with your pay and your hours. And just be very open and strategic about that. And also kind of like we were talking about, just be direct about what you're looking for when you're looking for a job. And when you're staying at that job, be direct with your boss about what's working well and what isn't working well. Kind of like Elizabeth said, like there's no harm in walking into your boss's office and saying, hey, I've been here this long. This is what my short-term goals are. These are what my long-term goals are. How does that align with you and how you see my role in our organization? Because if you're not getting any of that from your leadership, then I would encourage you to go find that. You know, set up those meetings and make them sit in front of you and say, like, this is what I want from you, and this is what we have envisioned for you. And if that doesn't align, then listen to that. Well,
I would echo what Dr. Kapur is saying. Thank you for that. But as a trainee, it's a little challenging to be able to speak so assertively. So maybe phrasing it as, what do you suggest? What do you recommend for me? Or is there some mentor you have that I could talk to that can help guide me during these challenging times or meet my goals in a certain place or a certain program? So yeah, anybody else have anything they wanted to share on that?
That's a very good point you're making, Amy. That's what we do in our program, having a mentorship with a one-on-one with the faculty. But you can do the same thing in your practice also. A mentor need not be within your program or within you. The mentor can be outside your system. Still, they can guide you and help you. Mentor is the one who listens. That's all. And they guide you if they have an experience other than what you have already. So mentorship is always helpful in every field. I just wanted to give one bit of information what I got. I had a chance to go through nurse practitioners' burnout statistics and the write-ups. I was totally shocked how they are so similar what we are going through. One of the bad thing they put in the evaluation was, they say 1 out of 7 will quit their job. 1 out of 7 nurse practitioners say they are going to quit their job because of the burnout. So I never pay attention to that because we do have nurse practitioners in our area, but not in my department. But they do work in the urgent care and all the places. Oh, your boy is coming on the way. So that is true in other fields also. One of the nurses put this comment. She said, I become a corporate drone with the prescription authority. This is what she wrote in the comment about the burnout. She called herself as a corporate drone with a prescription authority. That's all it is. Because they see so many patients, they do have a burnout. But when I look at the solution for the thing they come out with, we already talk about all those areas of autonomy, control of our workflow, support system. But one thing we have more than what other people don't have, at least in Advocate, is the dictations and the digitization of our electronic medical record. Because that started in 2000. After 24 years, now that's the highest number for our burnout. That's the highest reason for our burnout is we spend so much time on dictation, taking. Now, at least in my group, this is what we did. We have a poll. My nurse, my MA, they see that. None of them comes to the doctor direct. They filter everything before the news come to you. So you are filtered when you get that notes or no questions or the help, whatever it is. Most of them are managed by them. Very few things come to you. So build up a good support system and ask for help with the administration. Tell them what you want. If you want a dragon, ask for a dragon. If you want scribble, ask for a scribble. They may not say right away yes, but if you find out somebody else is using, they'll say, oh yeah, no problem, doc, I'll get it for you. So you will be surprised. My partner got so many things like that. He knows how to find out which hospital is having it. He will come out and say, Sanjay, these guys are using that. I'm going to, I said, go ahead, I will come with you. So you have to ask for your own help. There's no other way other than asking for help. That's all I want to say. Thank you.
That actually segues perfectly into the last question I have, and that is, what advice do you give to new physicians who are about to sign their first contract with a hospital system or a private practice?
They are different.
Yeah, they're so
Hospital-
different.
Yeah, I will give up because I'm in this for 50 years. Hospital system, there's not much you can do because this is a standard. Most of the hospital system have a standard contract. Very few negotiations you can make. Whereas in private practice, you can make a lot of negotiations because you have a comparison with other groups in your area. You can say that group is giving, this group is doing. Hospital system will say, this is what it is, take it or leave it when you start as a new. So you look at the system, if you are a new physician, which system have low attrition rate? Low attrition rate. If that hospital is going through like a revolving door, you better stay away from them because there is a reason why there is a revolving door like that. That means they are not respecting the doctors that much. That is the piece of advice I will give it to my graduating resident. Wherever you go, ask the retention of the doctors there. Same way with the groups. You can ask the same question. If somebody treats them well, they will not leave unless for personal reasons. So those are the piece of advice I give.
I don't know if it's answering exactly this same question, but determining culture is really important. So it's not really about contracts, but more, you said that the series when we started was about focus of women in sports medicine, and kind of segued also into like minorities in sports medicine. Look at your demographics of where you are and look at who your leaders are and whether that is also representative of you, your priorities, and what you're looking for. So if you are a woman going in, to sports medicine and practice, are there other females in leadership positions? Are there others that have significant others, hobbies, children, parents, like other things that they're doing out of work, and those things are supported? If you are a minority, are you going to be the only minority, or are there other people there? These are all very important things to kind of look at that help determine culture that may not come across in necessarily a contract, and probably play a bigger role in determining whether you're going to be happy or not. So it's always about finding your people, right? That's how I chose my field. That's how I chose my training. That's how I made my fellowship when I had it, is that I wanted to make sure that when the applicant came through, and even now I'm on the hiring side now, for our group here in Minnesota, I want them to understand who we are as people and what we value and what we prioritize and what we're looking for somebody to bring to our culture, and also what we can bring to them to help them feel supported. And so I think that's what you should be really looking for when you're looking for where you want to land, is are these the people that you want to work with? And also, kind of speaking to the last point, how long have they been here? Right? That's very important. Like if you have people that have been here for 10, 20, 30 years and they are happy and fulfilled, that's a much better sign than people who are, there's constant turnover. And that's not only with physicians. Ask them about their staff, right? How often are your trainers leaving? How often are your nurses leaving? How often are your office managers leaving? Right? Because that will play as big a role in your culture and how happy you are there. So I didn't answer the contract question, but those are things that you may not ask, as a trainee, because you're just looking for a job. I understand, like before when I was saying like, be bold and ask what you want for. You're not going to do that when you're a fellow and you don't have a job and it's April and you're like, I will take whatever job I get. I guess what I mean is, after you sign up for that job, don't just put your head down and bury your head in the sand and think like, this, now I'm stuck here forever, right? You always want to reevaluate that. And then once you're in, kind of like Elizabeth alluded to, once they invest in you and you invest enough time in there, they don't want you to walk. They really don't. So it's not going to happen like a month in, right? Like, don't come to your boss a month into your job and be like, this isn't what I signed up for. Like, they're going to say it takes time to build a practice. But if you're 3-5 years in and you're not happy, that's a red flag, right? And then if you talk to other colleagues there that are 3-5 years in and they're not happy, or they're not doing what you want to be doing, that's not a great fit, right? So.
Yeah, I'll piggyback off what Rahul just said as well. Ask the questions. Like, if I had one piece of advice, it's ask the questions. And maybe the second one is have a lawyer look at your contract. But I was planning on a position, so coming out of fellowship, graduating June 30th, and I found out the last week of May that the position I thought I was going to be taking, I was not going to be taking. So I've got 4 weeks left before I graduate, before I have no job, no income, nothing. And I still was able to apply to multiple jobs, get multiple interviews, got 2 contracts, and, like, full disclosure, played them off of each other a little bit. And I'm in a hospital system, and I was able to negotiate several points of my contract. So it wasn't even so much salary. Like, one of the points, and this was something that they realized later on was an oversight, and they changed it for everyone. But our hospital system spans, I want to say somewhere close to like 100 miles north to south and like 40 from east to west. And our non-compete, and not that they're really a thing anymore, but like our non-compete was 15 miles from any building. So that included all like our outlying labs and stuff like that. And I was like, I'll agree to the building I work in and the hospital, because none of the rest of that has anything there that's so far away from me. It has no bearing on my practice. My patients are not going to follow me that far, but it took away the entire Western Michigan for me if I was to switch health systems. And so I would have had to go to Lansing or further to get away from it, going back across the state. And so I was like, the worst you can do is the worst they're going to say is no. So I asked, and they're like, oh, actually. And so now that's not even in the contract anymore. So ask the question, because again, the worst they're going to say is no. And if they say no on enough things, that's not the job you want. So if they're not willing to work with you, one of the biggest things I learned in the leadership program I went through, it was go where your energy is welcome. And if that's not where you're welcome, it's not the job for you.
All right. In interest of time, there's so many great questions here. I know there's a lot of things that we could talk about, like the RVU-based system and how do you navigate that with administration. And but anyway, I'm gonna turn off the recording. If anyone has any final question, any panelist has any extra minutes, they can answer any questions. If you guys have to go, you can go. But thank you. Just gonna say thank you to all of you for attending and helping us navigate this important topic. I'm gonna turn the recording off now.